What is practice nursing? So you're a nurse and you're wondering what's it like to work in a GP clinic? Or maybe you've just landed your first general practice job and realize you're not actually quite sure where to start. Well, we know a nursing career in general is incredibly rewarding, but practice nursing in particular, or working as a nurse in a general practice setting, can be quite rewarding in and of itself. Why? Well, practice nursing is one of the fastest growing health disciplines in Australia, with over 60% of GP clinics now employing one or more nurses, and with many of these clinics looking to expand their nursing teams even further. So demand for practice nurses is definitely on the rise, which is a great thing if you're considering a move to this sector. So what makes practice nursing so special? Well, several things in fact. First of all, lifestyle and work-life balance. Practice nurses get to enjoy more flexible and much more family-friendly working hours than our colleagues in the acute sector or even in aged care settings. Many practice nurses will work part-time and mostly around business hours, with very little, if any, late-night work or work over the weekends. Another benefit is getting to experience longer and stronger healthcare relationships with patients who are under our care. Most nurses working in general practice will get to care for people throughout their lifespan, from babies through to adults and senior patients. Continuity of care means practice nurses often see the same patient through different stages in their life. And as a nurse working in a general practice setting, you may find yourself providing care as varied as prevention and health promotion advice, through to helping patients to manage their chronic conditions, or providing care and treatment during an acute crisis. Another good thing about general practice is we usually get to work in small teams. Because general practices are mostly small to medium businesses, every practice can be quite unique in its approach to care and even on the focus of conditions or specialties they manage. General practice teams tend to be small, which means nurses will often work very closely with the doctors at the practice to bring about obviously the best health outcomes for the patients. This often means that nurses are encouraged to find a suitable area of interest to do further training in, or to even specialize in. This could be things like immunizations, wound care, chronic disease management, or even health promotion. Nurses will often then become leaders in these areas at a practice level and even help to coordinate processes and policies that would best suit the practice and the patient's needs. So as you can see, practice nursing has a lot going for it. Next, we'll talk a bit about common practice nurse tasks and responsibilities, as well as what kind of training is recommended for nurses who are new to general practice.